Hey everybody, welcome back to my blog. Sorry I've been gone for so long. I have been going through a whole bunch of health stuff and had to kind of taper off for a few weeks because I was put on some new medications to help my newly found condition. But this blog, I wanted to go over advocating for yourself in the health field because that is something I am currently working through right now. And then also just what has been going on with me over the last last 6 months, but year and a half, and most of my life. It comes to find out. I've come to find out. Yes. So what we found out is that I have epilepsy, and it's something that I have had my whole life, and I was unaware of it. I have had small seizures before, or they have been seen through CAT scans and that stuff, but I was told they happened mostly when I was in my teen years, and I was told by the doctor at the time that that's a natural thing for girls to have. Some women, just their hormones changing and that stuff can be overwhelming for their body, and they can have very small seizures, and it's something that will go away within their life as they kind of grow into themselves and whatnot. So we didn't really think anything of it. I've always had hormone problems. I started developing, breasts and other things when I was around 5 or 6 years old. And then I've always had thyroid issues that were really prevalent when I was in high school. And then it's something that I have struggled with on and off my whole life. Some years it's great, and then I'll go through a stint of having to be on medication and so on and so forth, and it's just kind of all up in the air. But over the last year and a half, my memory, my energy level, my mental sharpness, all of that has really been declining. And we couldn't really figure out why. And then at the beginning of the year, something happened that caused me to really have to search for what was going on, because it was something that just was really out of character for me, and it caused a lot of upheaval in my life. And I was really struggling to remember any details of the months prior to that and leading up to and whatnot. So I have a great doctor who really has been working with me on all of this. We compiled a list of my symptoms, of my previous background. We did a CAT scan, and in the CAT scan it showed that I had all these lesions on my brain. And she said, that's really not normal. To her it looked like it had been small seizures, probably focal seizures, if not general seizures that were, I think they're called myoclonic seizures, where you're alert and awake while they're happening and don't necessarily know they're happening. You may just get tired, or you might zone out for a few seconds, and then once it stops, you're just like so fatigued you can hardly function, which is what I was experiencing. So she had me go see a specialist or neurologist up at OHSU, and we did a EEG and an MRI and another CAT scan and just a whole slew of testing, and he confirmed that epilepsy is what's causing the issues, and that I needed to start a course of action for my medications and to get myself back on track there, because it can cause dementia. It can cause a lot of major issues if it's not treated. So that's what I've been going through. The last month I started medications about a month and a half, 2 months ago, I think, and that has been a really tough experience because they numb your neurotransmitters. The point of them is to calm them down, and if you go on too high of a dose, you just kind of feel like a zombie. So they started me on a higher dose and just kind of started tapering me down. So it's been really tough. I can't sometimes leave the house. I can't, get out of bed a lot of the times. I feel horrible most of the time. And that's been a struggle for sure. Luckily, my doctor has been slowly kind of tapering me down to find a dose that's right for me. And then on top of that, he's a huge advocate for CBD, which is a derivative of hemp or pot. But it's the kind that does not make you high, which is awesome because I'm not huge into like getting high, getting drunk, that kind of stuff. That's just never been really my jam. But what it does do is help just kind of calm everything down in my brain, stop the seizure activity, but still allow me to function in society, which is awesome. I don't feel like a zombie. So we've been slowly kind of amping the CBD oils, edibles, and that kind of stuff up, and tapering down off, not completely off, but tapering down the medication. And that has worked wonders for me. I can't even like explain how amazing the CBD has been. And I didn't think I would be one of those people that's like, oh yeah, I'm so hard into, you know, CBD and the healing properties of hemp and marijuana and that kind of stuff. But guess what? It works and it's awesome. And it's helping me so much. So that's amazing. Going through all of this and really through my life, because I've had so many hormone issues and just, I mean, it's like every year or every other year there's something that health-wise big that happens, and I just, it's so much. I've really learned that you need to do your part and advocate for yourself, because so much can get lost in translation. And in talking to a lot of people over the last few months, really, but also years, just, you know, I have aunts who have horrible health issues, and you know, they're in the Oregon health system, so you know, they can't get into those specialists, and they have to go through all of these hoops to get what they need to live a normal life. To friends who don't have insurance because they can't afford it and don't qualify for like OHP or whatever state insurance, if their state has insurance to cover them, so they can't take care of themselves, so on and so forth. I've just kind of written up a list of things that I feel like people need to know in order to advocate for themselves and get to that end goal of living a normal life. So the first thing is do your research. Like, once you notice that you start feeling weird, or you have a bump, or you start developing around, whatever it is, do your research on it, and know that when you go to that Google engine and type it in, it's gonna come up something terrifying, like it's cancer, it's, you know, some sort of rare skin disease that only 1% of the population has, and blah blah blah. Chances are it's probably not that. But do your research, really, you know, kind of weed through, figure out what your symptoms really are. You know, if you're going in because you're having chronic headaches, is it migraine status? Is it, you know, on that 1 to 10 spectrum of pain? Where is it? Explain kind of where in your head it is, so on and so forth. Really kind of figure out what it could be for you, and then have verbiage to tell your doctor exactly what it is that you're experiencing. And then once you go and see your doctor, if they give you a diagnosis, which they should, after blood work or whatever, really go heavy into your research and see, you know, what to expect on medications, new medications you may be taking, what things you shouldn't be eating in correspondence with those medications. For example, like with birth control, you shouldn't be eating grapefruit when you're on most birth controls because it completely counteracts the birth control. So just be really careful about what you are doing in correlation to those new medications or new treatment plans. Figure out what kind of natural things you can do for yourself, and run it by your doctor and make sure that those are things that are okay to do with your medication or your course of action. So that's a great way to show your doctor, one, that you really care about the outcome about this and you want to lead the most normal life you can. And also it's a way for your doctor to be like, I really want to help that person because they are advocates for themselves to make sure that they are getting better. So that's one thing that's really important. The next thing I would say is keep track of your symptoms. This has saved me so many times I can't even tell you. I have a journal, this is it, of symptoms that I'm feeling day to day. And this is especially important when you are on new medications or on a new treatment plan. Just really saying, you know, hey, the first day I felt like this, so on and so forth. So you can kind of look back and be like, oh, okay, maybe I am getting better, or maybe this is actually not helping, this is making things worse. It's also a really valuable tool for your physician to really kind of judge medication interactions, new symptoms that may pop up, so on and so forth, and figure out if that course of action is actually working for you or not. I've had this, actually part of this whole epilepsy thing is like people are like, oh, it's just your, or people, doctors were saying it's just your hormones, it's you're not exercising, you know, for being a fat person, they're always like, oh, it has to be diabetes, it has to be these things that they most likely are not. So writing all of that down, showing, having your records on you, or, you know, a lot of the doctor's offices have the My Charts now where you can go in and add things into your chart and they make notes and everything. Really putting those together and making sure that's there for your doctor and your specialists. That can save you so much time and so much pain and torture in the long run. Next, making sure your doctor is actually listening to you. So this is one thing I think people are getting a lot better at, but still I feel like it needs to really be driven home that you are not stuck with the doctor that you have. Sometimes, I mean, there are very rare occasions where you are really stuck with that doctor, but I mean, 95% of the time you can change the doctor you're going to. If you feel like your doctor is not listening to you, if they are not making eye contact with you, I know it's really common for people, for doctors and nurses to come in and just sit down and start typing all your symptoms down, but if they're not turning to you and saying, okay, this is what I heard you say, this is kind of the order of everything, so on and so forth, is this right? That doctor isn't gonna, they're gonna miss so much. They're gonna miss so much. So kind of if they don't have that human factor, that you're a living, breathing person and not just somebody you need to prescribe something to, you need to see a different doctor. Or if you feel like your doctor is just not getting it, is not going the extra mile to figure out what the issue is with you, it is okay to get a second opinion. It is okay to just call up another doctor and say, hey, this is what's going on with me. I'm not getting where I want to get to. Do you think that you could help me with this? You know, these are okay things to do. Doctors are human. They are fantastic. They are educated. They, for the most part, know their shit. But they're human and tired and overworked a lot of the time. So advocate for yourself. If your doctor's not working for you, move on to another doctor. It's what's best for you. And in this health field, you need to be able to advocate for yourself and do what is best for you, not what is best for your doctor. You know, sometimes they get a little stubborn, and sometimes you just need to move on, and that's okay. Make sure that, and this is really important if you have a lot of health issues, if you are seeing specialists and you have your GP, make sure they are talking to each other. If you go to your GP and then go see a specialist and the specialist starts to prescribe you something that maybe your GP wouldn't necessarily know about, make sure that specialist emails your GP to tell them what they've put you on and how much, what the course of action is, so that your GP can say, okay, I put this in their chart. Now, moving forward, if I have to prescribe them any medications that don't have something to do with neurology or whatever, you know, endocrinology, all that kind of stuff, I can look at it and see what is right for them. This makes it just 10 times easier in general, especially if it's something that's going to be long term. Like, so I have my GP, and then I have my endocrinologist, and I have my neurologist. My endocrinologist and my neurologist are people I'm going to be seeing for the rest of my life because I'm always going to have these issues. So they need to know who my GP is. They need to be able to communicate all three of them together and say, okay, Susanna's on these medications for, you know, maybe I'm on a birth control, and then make sure that can work with my thyroid medications, and in turn will work with my epilepsy medications, so on and so forth, so you don't have bad interactions and everybody's like, well, I didn't know you were seeing this person or on this medication. That doesn't happen as often anymore because of the My Chart program, but I've seen it happen still. It's happened to me before. So you just have to be really careful, make sure you have a list of all your medications, make sure everybody's talking to everybody else and looking up those charts. And if they don't ask you questions when they start you on a new medication, you know, remind your doctor, hey, I'm on these medications. Is that going to interact poorly, you know, with what I'm already taking? Or is there a different course of medication that my other doctor needs to prescribe me if I have to take this one, so on and so forth. So all really important things. In total, I think it's just really important for everybody to know that in the healthcare system, which is just kind of how life is in general, but you are going to have to advocate for yourself. You can't just sit by and say, oh, my doctor says this, oh, my doctor says that, so I'm going to follow exactly what my doctor says. You need to be educated about everything. We're in an age now when information is at our fingertips, and there's no excuse for not doing the research and not protecting yourself, and making sure that you're not going to be thrown down a path of even more discomfort and pain and stress and all of that kind of stuff just because of one little thing that shouldn't have been missed, you know. So please make sure you take care of yourself. Please make sure you advocate for yourself. Please make sure that you advocate for other people, especially our elderly population. I mean, you know, like my grandma, I know probably both my grandmas go exactly by what the doctor says, and it kills me because, you know, it's sometimes they're wrong, and sometimes, you know, things kind of roll out of control, especially with elderly people, because I feel like doctors are kind of like, you know, they're old now, and it's not likely this, and it's not likely that, and so on and so forth, and that population just doesn't think to question the way that our age group does. So make sure that you're advocating for others or reminding other people that it's okay to do these things. It's okay to get another opinion. It's okay to question the doctors, question authority, question whatever. Just be an advocate for yourself and for other people. So I hope this was helpful. I did write everything out. It's down below under this video. I just wanted to let you know my next topic will be on vitamins and supplements. I had a lot of people reach out to me about whether or not they're good, bad, do we need them, don't we? So that will be my next blog. I am not sure when I'll have it up, but soon-ish. In the meantime, a great book to read on vitamins is Vitamania by, I think it's, yeah, Catherine Price. This was written in, or published in 2015, so it's fairly recent, and I think her point is eat a healthy vegetable-based diet, you know, all the nutrients on a spectrum, and supplement when you absolutely need to. But I will go way deeper into that in our next vlog. Everybody have a really great week, and I hope everybody's doing well. Remember to be good to yourself, treat yourself with kindness, and treat others with kindness. I will talk to you later. Bye.